Hello and happy Monday, everyone. So I'm here with Dr. Bita, MD. She's one of our most senior level medical doctors here, and she works on Center for New Medicine side. So remember too, and she also deals with cancer. So she has been working with Dr. Keneally for many years now, and right under her umbrella, and she is amazing. So today we're going to work on the immune system. Please, please share this with your family and your friends, because community is healing, and that's what we want to do for you. We want to spread the word. You hear about plane crashes, but you don't hear about all the things that people die from, and we can change that. So education is empowering you to really succeed. So with that, here's Dr. Bita.
Hi everyone. Thank you for coming in. Thank you for tuning in and listening. So how many of you have been sleep deprived for one night or few nights and then got sick next day? And do you guys know why that is? Do you know why you get sick? People sometimes may not even realize it. One of the reasons is that your immune system, your T cells, which are part of your white blood cells, your natural killer cells, usually that goes and engulf the cancer cell, the virus, the bacteria, they don't function that great. So that's why when you're sleep deprived, you do get sick. And me working in urgent care and private practices, I don't get sick just by being involved with patients with viruses, or if they have pneumonia even, I don't get sick. The only time I personally would get sick if I'm sleep deprived. After a few nights of sleep deprivation, I could get sick. So today I'm going to talk about the immune system. A lot of us don't realize how sleep is crucial for our immune system. A lot of us who travel, who are sleep deprived, don't realize that we're actually damaging our immune system. You may function fine with 3 hours sleep. You may function fine with 5 hours sleep, but your immune system is not doing well in 5 hours sleep. Optimal sleep is up to 8 hours. And you want to go to bed 10 at night till 6 in the morning. The reason is 9 and 10 is important is because that's when your cortisol level goes down, that's where your melatonin production starts to go up. You want to dim the light at night because it suppresses the melatonin production. You don't want to be on computers. The blue light, the ray from the computer, it suppresses the melatonin production. So that's important, and it plays a key role. Melatonin plays a key role in our immune system as well. Hormones in general do. And number two is stress. Why is stress affecting our immune system? Because it affects our hormones. It elevates our cortisol level. Indirectly, cortisol level elevation, it causes elevated sugar, causes obesity, causes heart disease. Elevated cortisol level also suppresses our immune cells, natural killer cells. Also, adrenal plays a key role. When we are constant stress, our adrenal gets suppressed, which all of us do have some sort of adrenal insufficiency. Our adrenal is low, so I tend to give supplementation to my patient, sometimes DHEA, sometimes desiccated adrenal, some sort of adrenal supplement to help our adrenal. Because as we get older, after age 40, 50, our adrenal does go down. So that's the key with stress, suppressing our immune system. And yoga and meditation plays a key role. If you stress a lot, you want to release that stress. Some people do it with prayers, some people with yoga, some people with meditation. You want to find out what is it that stresses you. If it's a family member, it's a family member. But if it causes stress every time you go visit them, that may not be good for your health. Doesn't matter if it's your mom or sister or father. Sometimes if a family member causes stress in you, you may have to eliminate it, may have to see them less. You have to look at the root cause. What is it that's causing that stress in your life? Then number 3 is nutrition, diet. Some of us, when we're sick, for example, we may have low energy and consume a lot of sugar, sugary stuff. because that gives you energy, but it feeds the virus, it feeds the bacteria, it makes you worse. When you feel like you're coming down with cold, you don't want to keep eating sugar. You don't want to have sweets, bread, pastas. When I talk sugar, I'm not talking about actual sugar. I'm talking about carbohydrates. So not necessarily complex carbohydrate that you get from fruit, maybe that's fine, but simple carbs are not good. Because what sugar does, our phagocytic cell, which is part of our natural killer cell that goes and engulf and eats up the virus or bacteria or abnormal cancer cell in our body, we suppress them by 50%. That's why most of my cancer patients, I say, please do not consume sugar, because you're going to feed those cells and because you're suppressing your immune system. So that's sugar, but in terms of nutrition and diet playing a key role in our immune system. So people don't realize, and diet is so important. Unfortunately, a lot of us doctors haven't had much nutritional training. I had to study nutrition by myself, on my own, to learn more about it, because we didn't get that training. So nutrition plays a key role in our health. And in terms, it plays a key role in our DNA. Like, for example, broccoli, cruciferous vegetables are great for our health. How many doctors have prescribed broccoli for their patients? Has said, go eat broccoli, cabbage, eat arugula. You know, all these vegetables, it helps your immune system. And they also protects you from free radicals. So now what we have to think about is, because in this world now we're living, constantly we're exposed with toxins, we're exposed with free radicals, we're exposed with stuff that can change our DNA, can change our cells, can lead to cancer. So we have to protect ourselves by the right nutrients. Diet plays a key role. People don't realize that. You want to eat good green leafy vegetable. I'm not talking about everyone becoming vegan. No, red meat is good. Lamb is a good type of red meat. Chicken, beef, fish, you could consume that, but you don't want to consume too much of it that causes acidity in your body. If you want to know if you're healthy, if your body is good, go check your urine pH. If your second urine pH is alkaline, then you're good. You're eating right, your body is functioning right. But if you're acidic, your pH is less than 7.4, that means your body is acidic. That means your diet is not right. That means you have to do some lifestyle modification. Stress increases the acidity in our body. So it's key to keep your body alkaline. It's key to have a good nutrition, because I always tell patients, if you ate an apple 50 years ago, it had way more vitamin and nutrients than it equals to 50 apples today, because the soil doesn't have the same minerals. So you don't get the same nutrients. That's why a lot of us are nutrition deficient. I do the nutrition testing on my patients, and a lot of them have vitamin deficiencies. And that's why I tell patients sometimes we do need to be on supplements, food-based multivitamins, because it's important. Our body is vitamin deficient. But I don't tell you guys take this, take that. As you guys know, I always check your vitamins. I say you need this, you need that, because of your vitamin test. And I always want you guys change your multivitamin. Don't take the same product for years. Always change your B complexes, your probiotics, your vitamins. You want to rotate them. Because I myself, during my pregnancy, I took the best, top #1 prenatal, but I did the vitamin test. I still was nutrition deficient. Then I switched to something else. Then I switched. I constantly check myself and switch vitamins. Then I realized there is no perfect vitamin. We really have to switch and change, and we need to, yearly basis, we need to check our vitamin level. Make sure we're not low, because vitamin D is #1 for our immune system. Vitamin D. And 99% of my cancer patients, they all have low vitamin D. So if you know that vitamin D plays a key role, we should all be on vitamin D. And that's a test, actually, you could just do with a simple blood test at your doctor's office. You could ask your doctor to check your vitamin D, 125 hydroxy D. So that's really, when you supplement D, you want to do it with D3, and you want to make sure you have K2 with it. It's important for absorption, and it's good for the cardiac health. So, for example, people will talk.
I'm just saying, what level do you like?
Oh yeah, vitamin D level optimal, you want to be 70 to 80 on the level. Higher side, the range tends to be from 30 to 100. A lot of doctors, when their patient is 33, they say it's fine, but it's not. You want to be high level. And the problem is, a lot of us, when we have viral infections, viruses downregulate your vitamin D. So you take 1,000 unit vitamin D, you don't even see it. It doesn't affect your blood work because you have viruses that downregulate your vitamin D. That means you have to take way more D to saturate your body to be absorbed. So next topic is going to be about toxins. Toxins like infections in terms of viruses. As I said, viruses downregulate our D. Vitamin D and oleic acid, which comes from olive oil or coconut oil, plays a key role in our macrophages. They're all macrophage activating factors. So what are macrophages? Macrophages are part of your white blood cell that goes and engulf cancer cell, abnormal cell. A lot of people, a lot of us, daily basis, we have abnormal cell. They're cells that are mutated, that are abnormal, that needs to be engulfed by our immune cells. But what happens when you consume high sugar, you're sleep deprived, you're stressed, you have low vitamin D. All these factors leads to low activity of your macrophages. Then all these abnormal cancer cells will, instead of being disappearing, they'll be adding up, and then next thing you know, they form a tumor. These cancer cells adds up because now your macrophages, your natural killer cell, cannot go engulf them and get rid of them because they're not functioning right. Then that's how tumors get formed. So infections, there are some oncologists, that was a TED talk I was listening to, it was saying 80% of cancers is due to viruses. Viruses, yes, it does play a key role in affecting your DNA, in affecting mutation. It affects the intracellular, it affects your cells, it mutates your cells. So that's why viruses in some cases, like HPV, leads to cervical cancer, leads to throat cancer. High Epstein-Barr, CMV, if you have a bunch of different viruses, they can suppress your immune system, and that can lead to cancer, yeah. But I don't believe it's 80%, but I do believe viruses plays a key role in our immune system. And a lot of us are exposed to viruses. So there are herbal supplements you could take to keep the viral load down. There are enzyme testing we could do to see if the viruses is affecting your immune system, like nagalase, which my patients are familiar with. I follow that 4 months, 6 months, 3 months to see how they're doing. So the next, toxins in terms of pesticide, herbicide, we're constantly exposed to it. Our body is constantly exposed to free radicals. That's why diet plays a key role. That's why you need to work extra hard and get your green juice in, eat your vegetable, eat your plant-based to help you from getting rid of these free radicals. Because pesticide, herbicide, all these can overload your body. Like heavy metals, like mercury, cadmium, they can overload the body. They can affect your Krebs cycle. What is Krebs cycle? That's, mitochondria, small organelles inside your cell. They're the one that produces ATP, energy in your body. And all these metals, they can affect the Krebs cycle, which occurs, the ATP production in the mitochondria. It can all be affected. That's why free radical is toxic to our body. That's why consumption of antioxidants is important. We need to constantly consume antioxidants. We need to make sure we do our green juices, or we drink green tea all the time, or we take our resveratrol, or whatever supplement, whatever. There are tests I do at the office that check your antioxidant level, like SpectraCell. That will check your antioxidant, or other NutriEval will check them to see if we are depleted or not. So if we are, I tell my patient, consume more red leafy fruit, vegetables, drink more green tea. Some cases I put them on curcumin, turmeric, all that. So free radicals, then other toxins like Parasite, Candida. Candida problem is it can affect our gut. Gut plays a key role to our immune system, our immune cells. So we want to have a healthy gut. If we have food allergies, if we have a lot of Candida overgrowth, it affects the bacteria in your gut then as well. If you have too much bad bacteria, too little of the good bacteria. And these all affect your immune system. So you want to have a healthy gut. So a lot of people know about leaky gut. Some doctors say everything, even cancer, chronic diseases, everything starts with your gut, because gut play a key role with your immune system. So you want to make sure you have healthy gut, you don't have bloating, you don't get pain after eating, you don't have a good couple times bowel movement a day, you don't have constipation. I have a brand new patient today who says, I don't have a bowel movement every 4 or 5 days, and that's very bad, and I see that a lot. Why is that important, to have bowel movement twice a day? To get the toxins out. Exactly, get the toxins out. What's other ways do we get toxins out? Sweat. Exactly, sweating. I tell patients, a lot of people with breast cancer, they don't sweat, they have history of constipation. They don't have good bowel movements. So what happens? All these xenoestrogen, environmental estrogen, gets absorbed when you're constipated. You're not eliminating the toxins. You should really have healthy person, healthy bowel. It's twice a day bowel movement. And then also sweating. A lot of people don't sweat to get all these pesticides. Cadmium, which we are exposed to, even if we're a non-smoker, there is cadmium in shrimp, there is cadmium in the air, there is cadmium in a lot of things that we eat, we get exposed to. The best way, easiest way to get rid of cadmium is by sweating. It doesn't have to be infrared sauna. It could be any sauna. Helps you to sweat, get the toxins out of you. Simple steps, simple stuff that everyone needs to do to keep their immune system strong, keep their health strong. So then, problem with mercury is a lot of people consume fishes, a lot of fishes, 3-4 times a fish, and they're pescatarian, or they believe it's healthy, it's good for them, but it's not, because ocean is polluted now. There's a problem with ocean, Fukushima. But Japanese are protected because of so much iodine they consume in their diet. There's seaweed. Iodine and the seaweed, all these bind to radioactive material, gets that out of your body. But majority of my patients are iodine deficient. Everyone I put a drop of iodine on the wrist, it's gone. So iodine protects us from radioactive material. It's good for our conversion of estrogen. It's good for our thyroid. That's a supplement really that a lot of us need to be on, because now the salts don't have iodine. It used to have, but they removed the iodine from the salts. So the mercury, you can't just sweat mercury out of your body. Lead, you can't just sweat it out. So there is other ways to get rid of those, which I already talked about on my talk on heavy metals, how to get rid of those. But important is, let's say you're gonna eat sushi. You want to make sure, there's Parasite too. I'm going to talk about that. But you want to make sure you take chlorella, you take your iodine before a sushi meal. Or if you want to eat fish, you want to take chlorella. Chlorella will bind to that mercury so it doesn't get absorbed in your GI tract, so you don't absorb all the mercury. But that chlorella cannot get rid of the mercury from your tissue, from your bone, because that's where mercury and lead are stored. They're stored in our bones. So there are some DMSA medication that I can prescribe, or eating a lot of parsley, cilantro can help to not absorb, but it's not going to get rid of it. And for lead, there is some IV chelation that I do. There are some ways we could get rid of. But in term, for a proper immune system, you want to make sure you don't have high heavy metals. But the problem is if you go to your doctor and say, just do blood test on me, it's not going to show much because they're stored in your bone and tissue. You need kind of to do an IV provocative test or do a hair test for heavy metals to find out what the levels are. So parasite also plays a key role in our immune system because it's something that suppresses your immune system. And parasite has been linked with a lot of cancers. People with breast cancer, people with prostate cancer, been having parasites, melanomas. So you want to make sure you don't have it, but the problem is you can't just go do a stool testing. There are certain ways. There are a lot of good Facebook members there. They have, there are people, patients, been having issue with parasite that they went through it, and there is Facebooks that they could join, Facebook groups to figure out. But a lot of doctors would just do a stool test and it doesn't show. So we do biomeridian testing, and I do ultrasounds on my patient. If I see liver cyst in my patient, that's usually indicative of parasite. Parasite causes cyst in our liver. So most of the time when I detox, get rid of the parasite, that cyst will start shrinking. The cyst disappears. So the next that suppress our immune system, let's see, toxins, sleep, stress. I didn't make a cheat note. I think there are some supplements it's good to take. Some people may ask, what are good supplements to take for immune system? But if you don't do the steps I told you right now, you don't fix the sleep or exercise to get rid of the toxins, or you sweat, decrease the stress, all these, just taking supplements will not help. So you want to do these simple steps that I talk about, because exercising plays a key role for immune system. But too much exercise every day for an hour suppresses your immune system. Surgeries, for example, when people go do surgeries, that suppresses the immune system. When people have cancer and their cancer is stable, but then they go do a knee arthroscopic surgery or a toe, then there's cancer flares up. Because the immune system goes to heal that area and doesn't go and engulf the circulating tumor cell, then the cancer flare up. So you want to make sure if you have any kind of surgery, if you actively have cancer or had cancer, you want to do some stuff, which there's a protocol I put my patient on prior to surgeries. So, and the supplements, what are good to take? Thiamies play a key role for our immune system. So when I see patients who have low white blood cell, I may give them thiamies supplement. I may put them on mushrooms, mushroom extract. Vitamin C plays a key role for us. Vitamin D, as we discussed. There is a lot of a lot of supplement out there that you could take, but the key is not about popping supplements. It's about doing the basic stuff that can help your body strengthen your immune system. Hydration is a good way to get rid of the toxins. You don't want to have a dehydrated body. When you don't drink water, you're not flushing your kidneys. So then you're also accumulating toxins. So I always tell patients water plays a key role. Water is solution to pollution. So your body weight, if I'm 120 pounds, divided by 2, 60 ounces of water every day. Every morning when you wake up, you want to at least have 16 ounces of water. You could put a little bit of apple cider vinegar in it one day. You could do lemon in the water one day. The purpose with that is if you have enough stomach acid, then when you drink it, you make your body alkaline too. That's good. But some people can add a little bit of baking soda and water in it, especially when people have a lot of heartburn. They could do a little bit of baking soda. Coffee is not good for your immune system. People drink coffee. They're used to coffee. Everyone is used to coffee. A lot of people are. It's best to switch to a tea. Ideally green tea, but green tea has not enough caffeine. You could do black tea if you want. I do start my day with black tea. Green tea throughout the day because it's alkaline, but black tea is neutral. But what is coffee? Coffee is acidic, full of pesticide. So let's say you do organic coffee, but you're not getting rid of the acidity. You're starting your day by making your body acidic. How good is that to you? How good is that to your health? Because the purpose is to have an alkaline body, to keep your body alkaline. So by diet, you're doing all the greens, you're doing this and that, but you keep drinking coffee. That also suppresses your adrenal. Adrenal suppresses our immune system. So I think I covered it. How long did I talk to? I think I covered the basics. Yeah, let's go for questions. Let's see for audience here. Do you have questions? Go ahead, Brian.
Can you talk a little bit about dairy?
Okay, so talking a little bit about dairy, that's the question. So dairy, it's controversy because a lot of people say we're not meant to be drinking milk. We're not supposed to have dairy. Yeah, dairy it produces a lot of mucus. It causes allergy. A lot of people cannot tolerate it that well. But I'm fine with fermented dairy, like having kefir, having yogurt, butter, for example. Those are fine. I'm not that keen of milk, but if you want to do dairy, maybe you could do goat. You could see what your allergy, if you're allergic to it or not. I mean, it's good probiotic when you have kefir. Some people do coconut kefir. It depends, you know, if you tolerate it, fine. If you don't produce mucus, I always have people, especially my brand new patient, I have them off of dairy for a couple of weeks. And they realize, oh, my mucus is so much, my allergy is so much better, my sinuses is so much better. Yeah, so if you want in terms of source of probiotic, which I myself have kefir, sometimes goat kefir I do, and that's how I get it. But fermented vegetable you could do, and kimchi, kombucha, those are good source of probiotic. Because probiotic is important for our gut. Yes. Any other? Yes.
So I'm doing my heavy metal detox, chelated, and I just found out my liver function spiked.
Okay. So when you do, yeah, so the question is she started on IV chelation and her liver function. Yeah, it can happen with the IV chelation in the beginning. So what we have to do is make sure you're on milk thistle. Make sure, yeah, you do milk thistle and maybe stop other supplements. Yeah, you want to make sure you stop other supplements. You want to make sure you hydrate yourself well. You usually with chelation, I've seen to bring the liver enzyme down. It doesn't necessarily bring it up, but it could be the overload of heavy metals. So add a milk thistle to it. Maybe we have PK push, which is glutathione, which helps to clean the liver. Maybe doing hepar push is a homeopathy for the liver, and then also coffee enemas. And hold off of chelation, make sure you normalize. So one thing I see is Parasite when I treat my patient with parasitic medication, because I realize naturally treating Parasite, it takes years, and patients still see the parasite come out, but they still have it. But I put them on medication, and that sometimes also spikes the liver enzyme. So I just have them have a break, do the milk thistle, clean the liver, and bring it down, and then go back on it. Yeah. Any question out there for our audience?
Right, so someone said, what does your pH levels have to do with your immunity?
So when the body is acidic, it suppresses immune system. That's why you want to, for a healthy body, for immune cells, for your cells to function well, you want to have a neutral pH. You want to be alkaline.
Okay, and another one says, how does mitochondria functions relate to immunity?
So mitochondria has to do with ATP production. ATP produces energy in your cells, and it affects the key role. Majority of people, when they have suppressed immune system, they have low functioning mitochondria. As we age, our mitochondria gets suppressed as well. That's why we have to, anti-aging is to keep that mitochondria functioning right, to produce ATP, to make your cell work well.
And someone asked, what should your body pH be?
So we cannot switch our blood pH. Blood pH is always constant. So the pH we're talking about is tissue pH, is extracellular pH. So that you want to be alkaline, you want to be greater than 7.4.
Is high pH water, like pH 10, is that helpful?
So the question is high pH water is helpful? You could do pH water if you want to, alkaline water, but the key is that has to be on an empty stomach, an hour before meal or 2 hours after meal. You don't want to drink pH water constantly because you need that HCl, hydrochloric acid, in your stomach. Some people who drink alkaline water, they still have acidity because they have chronic disease. Something is going on, is not right. So that doesn't help by itself, and it could be also because the diet is full of animal product, or fruits are acidic, or coffee is acidic. So you want to know what you're eating as well. You don't want to just do alkaline water. Ideally, you want to change your diet to increase the alkalinity with the diet.
Chlorella helps a lot with that.
Chlorella helps with that too, and detox and help with alcohol, yes.
Yeah. With vitamin D3, what is a good compound to have together? Because my understanding is if you have vitamin D3 on its own, most of it is just going to get flushed out of the body. So
Yeah.
I've heard possibly a K2
Yeah,
combination.
yeah. So question is, what do you want to take vitamin D3 with to have a better absorption? Because by itself you could just flush it out. Yeah, vitamin D3 ideally for absorption, you want to take it with K2. You don't need much vitamin K2, like 45 microgram for 5,000 IUD vitamin D. And you could increase your leafy green vegetable. They have vitamin K. Problem is a lot of people who are on heparin or on Coumadin, they can be taking vitamin K. So they have to take the D3 by itself. But other than that, it's good to take the D3 with K2. And it is, you have to know, vitamin A, D, E, and K are fat soluble. You have to take it with fat. You have to take it with food. Taking it on an empty stomach, you're not going to absorb it well. It's like omega-3s, olive oils, you know. You want to take fatty food to absorb these. So if you're taking vitamin D3, you could take it with olive oil, with your food.
All right, someone asked, what if you use alkaline water to make your coffee? It's still not good.
I would say so. So making alkaline water with your coffee. I mean, you could do that. Check the pH. I mean, If your pH is fine after drinking coffee with the alkaline water, and your coffee is organic, and your adrenal is fine, you're fine. But the problem is coffee is a stimulant, and stimulants tend to suppress your adrenal. So you drink that coffee, you're good. By 2, 3 in the afternoon, you feel a crash. Then you're ready for your next coffee, or you feel tired. If that's not the case, if you're fine, that's fine.
Someone said, do you recommend vitamin IVs regularly?
Vitamin IVs regularly. It depends. When I was pregnant, during pregnancy, I would do IV vitamins weekly basis because it's sometimes hard to get the nutrients from the vitamin I would take orally. But it depends. If you have gut issue, if you take supplement that you see it doesn't get absorbed when you do vitamin check, you could do injections. You could do B complex injection. We have multivitamin injections. You could do IV if you need to. If you had gastric surgery that you can absorb well, then you could do that. It all depends, but I would recommend do a vitamin testing to see what your vitamin levels are. If they're low and everything is deficient, then you may have some gut issue. You may want to fix the gut. And then in the meantime, you could do IV vitamins. It's just hard to get IV all the time. So,
That was it.
okay, thank
Here's
you.
one more
Yes.
One more phrase. I understand the benefits of having matcha tea, but doesn't that have a lot of caffeine in there as well?
So the matcha tea, the benefit of it in terms of caffeine, matcha tea, because it's part of the green tea, it's a alkaline tea, it's not acidic, and then it has a lot of good antioxidant. The caffeine itself is not that much like a cup of coffee unless you're very sensitive to it. The way you could find out is cut yourself off of it, see if you have suddenly feel fatigued by 2 and 3. If you feel like you have withdrawal, then yeah. But if you don't feel any different, then you should be fine. Like I do drink coffee once or twice a week, but if I don't drink it next day, I don't feel the headache. I don't feel that, oh, I need that caffeine. As long as you're okay with that, that's fine. Because coffee, occasional cappuccino or occasional, you want to have that, why not? But just don't get addicted to anything. That's the key. Yeah. Thank you all for listening and tuning in. I hope it was helpful. And see you guys next month.